Hello, my name is Arlene Martinez, and today we will be discussing asthma. In the United States in 2010, it was estimated that 25 million Americans had asthma. 7 million were children. The incidence of asthma has been increasing due to environmental factors. So let's take a closer look at your lungs. On the left side of the screen, we can see why asthma makes it hard to breathe. Air enters the respiratory system from the nose and mouth and travels through the bronchial tubes to the lungs. On the left side of the screen, you can see an inflamed bronchial tube of an asthmatic. You can see that it's constricted and narrow, making it difficult for air to pass. Where on the right side of the screen, you can see a normal bronchial tube that's open and wide so air can pass freely. Signs and symptoms of asthma include coughing, wheezing, chest tightness, and shortness of breath. So let's take a closer look inside your lungs. So inside your lungs you have your bronchial tubes, which a normal bronchial tube allows air to pass freely. It's open and wide. This is how the airways look in a person without asthma. Air can move freely through the airways. But when you have asthma, inflammation and constriction can affect how air flows through the airways. Causes or triggers of asthma. An allergy is the immune system's reaction when exposed to what is otherwise a harmless substance, such as a plant pollen, mold, or animal hair, skin, or saliva. The immune system treats these substances called allergens as if they were harmful, causing a disruption to normal body function. Allergens are what trigger a series of reactions by the immune system during an allergic reaction. Asthma attacks can be triggered by allergies, which can temporarily increase the inflammation of the airways in a susceptible or weak immune system person. About 80% of children and 50% of adults with asthma also have allergies, and the 10 worst cities for asthma in 2010 include Richmond, St. Louis, Chattanooga, Tennessee, Knoxville, Milwaukee, Memphis, Tulsa, Philadelphia, Augusta, and Atlanta. Prevention. Initially, we want to make sure we understand how to identify our own asthma symptoms. Identify environmental exposures at home, work, or school so you know what triggers your asthma. Avoid highly polluted areas or cigarette smoke, and we want to make sure that we catch these symptoms early to prevent chronic or long-term symptoms. For treatment, most of the treatment emphasis has been placed on medication therapy, but there are also things that you can do that are non-pharmacological approaches. So for medication categories, we have your quick relief and your long-term medications. We want to make sure that we educate our patients to know the difference between both. So for quick relief, your inhalers are what act quickly to help relax or smooth out the airway muscle. And then long term, we want to make sure that we inhibit the underlying inflammatory process. Other non-pharmacological approaches include encouraging exercise and dietary changes such as the Mediterranean type diet. How do you know your treatment is working, or how do you know if it's effective? We want to reduce impairment, prevent chronic symptoms which require infrequent, twice weekly or less use of your medications, maintain near normal pulmonary function, maintain normal activity levels, and we want to make sure we meet our patient and family expectations and satisfaction with their care. We want to reduce the risk, prevent recurrent episodes, and minimize the need for emergency room visits. Most importantly, we want to prevent loss of lung function, especially for young children. We want to prevent reduced lung growth, and we want to provide optimal pharmacotherapy while minimizing side effects. Living with asthma. You are able to live a healthy lifestyle with asthma. Environmental or lifestyle changes do have to be made, though. We want to make sure that we educate to ensure how to monitor and understand your own asthma action plan. We want to decrease dust mite exposure in the home by washing bed sheets weekly in hot water and or use of dust mite proof covers. Avoid, again, highly polluted areas or cigarette smoke. Avoid indoor humidity to or below 60%. And try not to sleep or lie on cloth-covered cushions or furniture. Remove carpets from your bedroom and those laid on concrete. And keep stuffed animals or toys out of the bed or wash them weekly. Thank you.